Hello, students. This is Professor Roach. I wanted to go over just to give you some feedback regarding medication error case study. So, a lot of you talked about the potential side effects that could occur with Gus, and you did an excellent job on that. And I was very impressed with what you wrote down. One thing I just want to remind you is in the clinical setting, patients don't usually experience every single side effect that you mentioned. It's usually the most common side effects are important to assess. So I want to go on to the second question. The most concerning side effects that are that I would be or a nurse would be concerned with is definitely the side effects to Plavix. So Plavix causes bleeding, and bleeding can come from different orifices in your body. So what I'm talking about when I talk about orifices, I'm talking about the mouth, the nose, the stool, and urine. So because Gus had a surgical procedure, this would lead him to have an increase in bleeding. Another concerning side effect would be the dizziness, the hypotension, the vomiting, the change in vision, the drowsiness, the dysrhythmias, possibly that could happen. Because of these side effects, the patient would be at risk for falls, fluid and electrolyte imbalances. And also, they would be at risk for some life-threatening dysrhythmias. So, I want to go on to the question regarding what to assess when it comes to the critical side effects for the remainder of your shift. So what I was thinking and what I wanted to make sure is that you would assess for signs and symptoms of bleeding. So that would be in the nose, the mouth, the stool, and urine. You would obviously assess vital signs. A lot of you talked about that. And heart rate. You would assess for nausea and vomiting. The patient could become dehydrated, so you want to assess for intake and output, skin color, their oral mucosa. You would also assess for signs and symptoms of dizziness before getting the patient up to the chair or to the bathroom, and assess their mental status by performing a neuro assessment. Ask the patient their name, their date, and where they are right now, and looking for a level of consciousness, and assessing if there's any changes. Okay, so the next question talks about the interventions that you would do for him because he had some mild nausea, drowsiness, and hypotension. So a lot of you wrote for mild nausea, I would have him eat something that was bland, maybe some crackers, drink some ginger ale to kind of prevent the nausea. Those are great interventions. Non-pharmacological interventions are awesome. Positioning him upright would be good, but definitely changing his diet would be definitely a great intervention, and having him maybe not eat as much crackers and ginger ale, like I said. The drowsiness, you definitely would have to perform frequent neuro checks. I was thinking like every 2 hours, assessing alertness, orientation, assessing for confusion. You're going to learn about the Glasgow Coma Scale, so you would look at that and assess that, okay? Hypotension, definitely assess vital signs, especially blood pressure and heart rate, maybe every 2 to 4 hours. Assess the patient to see if they're drinking and eating, because that could be causing their hypotension if they're nauseous and they're not eating and drinking. Okay, so the next question talks about what would you need to monitor if further complications occurred. So what they're talking about is if the nausea got worse, you might need to give them some antiemetics. You might need to monitor his INO. You might need to look at his potassium level, which we talked about a little bit this week with fluid and electrolyte imbalances, because if his potassium dropped, then he could have cardiac dysrhythmias, life-threatening dysrhythmias. Drowsiness, I definitely would be looking to see if there was any confusion. I might need to consult with the physician if I see a change in his neurostatus. I might even need to call a rapid response if his neurostatus changes so much and he becomes so lethargic. Hypotension, you might need to give him some IV fluids. You might need to give him some medications to increase his blood pressure, or you might have to call a rapid response if the symptoms get pretty intense, okay? The other question I was thinking about is the legal and ethical ramifications that the nurse violated. A lot of you talked about negligence and benevolence, which are both things that the student nurse did violate. So, the biggest thing is that we are to promote a culture of safety, and not following the 6 rights, not following the 3 checks, not following the policy at the hospital would lead the nurse to be causing some damage, physical harm to the patient. So those are the things that I was thinking about. There definitely could be a lawsuit against the nurse if something happened to the patient, if there was physical harm. The workarounds that I thought about, and a lot of you talked about them, which were did a great job on that, is that the student nurse pulled and prepared medications for 2 patients at the same time. She reviewed and checked the medications of both patients in the medication room and left the cups on the counter, which is a huge error. Didn't perform the 6 rights, didn't do the 3 checks, and didn't scan the patient, which could possibly have caught her error. If she scanned the patient and then also scanned the meds, she would start to notice that the medications the patient was prescribed on the EMR were not the correct medications that she pulled from the Pyxis. The legal ramifications that she could face, we kind of you talked about that. She could lose her license depending on the severity. Not every nurse does lose their license if they make a medication error. She could be charged with negligence. The hospital could have a lawsuit, which I talked about. She could lose her job. But please always remember, and this is a thing that I think this case study is trying to promote, is that you do always apply your 3 checks before you even give the medications to the patient, the 6 rights. You scan the patient's armband and you ask them the patient's name and birthday. If you follow what Taylor Skills states, which is all evidence-based practice, this will help you to not make medication errors. So I hope this helps you. I'm trying to send videos to try to talk with you and have you kind of get some feedback from me through this. Okay. If you have questions, you can reach out to me. I'm available. Thanks. Bye.